Still C-section awareness month.
5 minutes about.
We're going to talk about abdominal supports postpartum.
Yep.
So, Katie, when and why would you recommend an abdominal support postpartum to someone?
Okay, so if we're talking specific to C-section, I really like these for C-section. I have no clear evidence that it supports improving abdominal closure or diastasis recti, which I get asked about a lot. But as far as recovery from the surgery itself, the birth itself, I find this really helpful. And there's enough research out there now that I feel pretty confident saying that we know if you wear some sort of abdominal brace after a C-section delivery, that you will feel less discomfort, you'll be up and mobile for longer, you'll have less distress, and there's some evidence saying that there might be less blood loss. And so all of those things are really, I mean, they seem like small things, but in the first few days after giving birth, if you can be more functional and in less pain and you can engage with baby more, then I think that those are all really, really positives.
I think too, again, we don't have the research to support it, but I know from clinical experience, so having talked to patients that use a wrap after cesarean section, and I used one myself after cesarean section, it did help a lot with proprioception of my abdominal wall. And so I can't speak to, I didn't have a vaginal birth, so I don't know that I would have had that same feeling, but it definitely helped me. I felt like I did not have a core immediately after, and I think obviously a baby is taken out quickly. So I felt very disconnected from my middle for a few days, and I found that this helped me with that.
Yeah.
It just gave me some, it's the same as if I was like, as a physio trying to facilitate a muscle, we use our hands or we would try to close and give some feedback. Yeah. It did that same thing for me. I was able to put it on, and I mean, a good pair of high-waisted leggings also might do the trick, but I did find the extra support very helpful, especially the first 2 weeks postpartum.
And I would agree with everything that you said. This also helped me with low back pain. I think that my core felt so weak, but you're right, like you just can't feel it. I was standing trying to be a mom, that it really helped with my low back pain that I was getting, and feeling like I wasn't going to fall out through my incision. Like I had a lot of this like forward falling out feeling, and it really helped with that as well.
Absolutely. So what I always tell people is when I see them before, I'll tell them kind of about the benefits that we do have some research for. I recommend people do size themselves during pregnancy, because obviously your belly is not going to be back to pre-pregnancy size immediately after. Bellies Inc. is a Canadian company. They have a fantastic product, but I always say there's like a few things I want people to look for if they are going to decide to abdominal wrap. So one, it has to be adjustable. Your belly is going to change tremendously over those first few weeks postpartum, and so you need to be able to continue to adjust it so that you can give yourself the support you need if we're using a wrap for support. The second thing I love about this wrap, and something you should look for, is it's made from like a tensor-like material. So if you have swelling, which again is very, very common postpartum, it's able to expand to that without constricting you. Because as the day went on for me, and being on my feet and moving around, I also had a lot of IV fluids. I was very swollen postpartum, and so having some forgiveness in the wrap was really helpful.
You could adjust it and change it throughout any given day, let alone as the weeks went by.
Or even just like putting it on initially, and then if I swelled after, like as the day went on, it would not put marks into me. The second or third thing I should say that I love about this one is it actually, when you put it on, maybe we can show a picture because I know we have a few. When you go to put it on, you actually can wrap underneath the belly and pull up. Which is very important, because a lot of the ones I see on the market are actually more corset-like, and they restrict the ribs a lot, which restricts your breathing postpartum, which we want to get going again, like diaphragmatic breathing. But also you don't want to be putting pressure down into a healing incision or healing pelvic floor. This allows you to kind of like lift up and lift away from your pubic bone and pelvis, which is really quite comforting.
And that's why they have kind of as 4 straps, because everyone has a different waist length from rib to like top of their pelvic crest. So I'm very short-waisted, and a lot of the ones that I could find in the store actually, as Eryn said, came up too high over my ribs. So this allows for you to kind of adjust for different waist heights as well.
And that was my last kind of tip, is just make sure that you size yourself properly so that it actually is more of a pelvic girdle support, so more hip level coming upwards and finishing before the bottom of the ribs, because you don't want to restrict your ribs postpartum, because then it can impact your breathing, it can impact your pelvic floor healing, obviously. And you don't want to be creating excess abdominal pressure when all those tissues are healing.
So this is a great one, but we have links to others on our website as well. These go on as soon as you can tolerate them after surgery. They shouldn't stay on indefinitely. You'd start some kind of exercise training program, and then they can come off after that.
Yeah, kind of think of when you like injure an ankle ligament, right? You might wear the brace for a few weeks while you're rehabbing, and then you slowly kind of wean off of the brace.
5 minutes.
Already?
Yeah.
Whoa. Okay.
Bye.